We are continuing our Stroke Month series by talking about blood pressure, which is a leading controllable risk factor for stroke. Dr. Moise Shafiq, a cardiologist with Medical City Healthcare and a volunteer with the American Stroke Association, joins me with more on why it's important to know your numbers. Good morning to you.
Good morning. How are you?
I'm so good. Glad to have you. So tell me, why is blood pressure such an important part of the Stroke Month conversation?
Yeah, so, high blood pressure hypertension is the leading modifiable or controllable risk factor for stroke. High blood pressure is often called the silent killer because a lot of times you don't find out until something bad happens. Almost 50% of Americans have high blood pressure, and a lot of them don't even know they have it.
Right. That's scary to hear, but it makes us want to pay attention a little bit more. Tell me, what can we do at home? Can you check your blood pressure at home? What does that look like as far as helping ourselves out?
Yeah, so most definitely, you can definitely check your blood pressure at home. It's very important to do so. But if you're going to do it, you got to do it the right way.
Right.
And so the way to do it is, you want to be seated in a chair with a back. You want to be relaxed. You don't want to be crossing your legs, both feet flat on the floor. Arm needs to be resting at approximately the level of the heart. Okay. Most time arm rests are too low. Desk, table, something like that. Prefer an upper arm cuff, a proper arm cuff. And again, you're not eating a sandwich. No one's making jokes. You're relaxed and hit the button.
And let it happen.
And let it happen, correct.
Nice. Okay, and we can do that. Those are easy tips to make happen at home, I think. And like you said, we can use a desk or a table to actually get the correct numbers. Now, many people assume they would feel something if something was wrong, but what do you tell your patients?
So, no, usually not, and that's the problem. It's called the silent killer. And
For
so
a reason.
A lot of times you're just not going to feel anything until something bad happens. Rarely people will start getting headaches, vision changes, but most times you're not going to feel anything until something happens.
Right. Now, when we do this blood pressure at home, what number should we be looking for?
Yeah, so ideally you want to be less than 120 on the top, the systolic, and less than 80 on the bottom. Those are kind of ideal.
Wow.
It's important. So blood pressure, it's going to fluctuate a little bit, and it's important to check your numbers over time.
Okay, so making sure we're doing it consistently. Are we thinking like once a week or?
Every day. Some of my patients, I have them even do it twice a day so they can monitor. Right.
Very good. Yeah. Okay, now we're also hearing more about the connection between blood pressure and brain health. What exactly does that look like and what should people know?
Yeah, so there's growing evidence that kind of links high blood pressure to cognitive decline and dementia. So that's why it's important to control your blood pressure now for your future brain health.
Yes, indeed. Okay, so it affects more things than just the body. I think obviously your entire body, but more than just your heart. And so tell me, what's one thing that our viewers can start doing today?
Yeah, so I would just say know your numbers.
Yes.
Okay, so get your blood pressure checked. You can get it checked. You can do it at home. A lot of the local pharmacies, and most definitely your primary care provider can do it.
Yes, indeed. Okay, and just a quick question: if we're seeing those higher numbers, call someone, take a walk. What does that look like?
Yeah, and if you're seeing higher numbers, then you need to contact your primary care provider. Get in, get checked, and if it needs to be treated, get treated.
Thank you so much for joining us this morning. I'm sure this conversation is really hitting the target for someone at home, and we're just glad to get the knowledge out there. And today's Stroke Month education is a part of the Together to End Stroke initiative, a partnership between the American Stroke Association and HCA Healthcare Foundation, locally Medical City Healthcare. You can learn more at stroke.org/strokemonth.